Thank you so very much for being such a spectacular part of our virtual conclave right here with our theme Futures, now bringing health innovations to the forefront. We're all set for our next session on combating health emergencies with technology and role of digital health ecosystem of the country. And joining us now is Dr. K. Madan Gopal, Senior Consultant Health, NITI Aayog, Government of India. We welcome you, sir.
Thank you, Economic Times, for giving me this opportunity. So this is a very pertinent question that is very relevant also in the current context. The use of technology for disease emergency management, as well as what we see the role of digital technology in the coming years. If you look at the journey of the digital health in the country, we have been using the digital technology or digital information in one way or other since the start of this century. We do have an IDSP program, that is Integrated Disease Surveillance Program, wherein we are collecting information about the health events, keeping a watch on that, and see what actions can be taken. We do have a surveillance system. The surveillance means information for action. That surveillance system has evolved in the last 15 years, and you have seen the resilience of that surveillance system where we have seen how the contact tracing and other things have happened. Having this system, which was there as a part and parcel of the public health surveillance mechanism, it would have been very difficult for us to manage the COVID pandemic. Having said this, I will just highlight you that how the digital infrastructure has evolved during the last 1 decade. The effort started with a vision for having 1.3 billion electronic health records. Even if you look at the our vision paper, that is Vision 2035, we have also envisioned that we would be using electronic health records for for managing the health emergencies, identifying the health events which are of public health importance, and then taking corrective actions. Efforts started in this direction from way back in 2010-11, wherein in the Clinical Establishment Act, we have having that each and every hospital which are participating in this Establishment Act, they need to maintain electronic health records. The other serious things happened regarding the digital infrastructure and use of this when we have included having a digital ecosystem in our National Health Policy 2017. It has envisioned a digital infrastructure with an interconnecting between all the programs so that ecosystem is there for providing affordable and accessible care to the people. With the launch of PMJ program, we have started to develop a digital stack. The digital stack gave inputs into the National Digital Blueprint, which formed the architecture and the framework for the launch of the digital mission. In the digital mission, we are trying to see that a UID is created for the health UID is created for the person individuals. That means which is known as ABHA, Ayushman Bharat Health ID. Then we are trying to create an ID for the doctors and the professionals, and an ID for the health institutions. This ID will be used for creation of the electronic health record, which will form the basis for your other services. If you look at the infrastructure which is available, one thing is for a TB program. Suppose I am availing services under TB program. I am registered there. If I get immunization services, I'm having information there. If I get registered myself for malaria services, then that information is there. But there is no common mechanism for talking to each other. If I have a unique ID, that is a common ID, then all these programs will be talking to each other, and this can be used for triangulating data and providing more insights for disease management and treatment. During these COVID times, one of the important highlights which have happened, because first of the important thing was that the treatment modalities was not known during the early parts of 2020. We were not knowing the treatment modality. One of the important basics of epidemic was that identifying the cases, detection of the cases, then doing contact tracing and surveillance of the contacts. That was the prime that is being happening since the last 1 century. That is the old age tested method of epidemic control is first detection of the cases, then identification of the contacts of the patient, detecting infection, then containing that infection then and there only. That's the basics of epidemiology which has been followed. To aid that thing, how the digital thing has come in, you might have heard about the Aayog Setu. It was developed by Ministry of Electronics and Telecommunication along with MyGov, and that was created. Essentially, if a person is positive, they have used the technology. ICMR laboratories are all connected to a digital portal wherein if a person is tested positive, his mobile number is mapped to that positive result. What this Aayog Setu did was that if the person is positive, wherever he has gone with the mobile tower triangulation as well as use of Bluetooth technology, any person who has come in contact with that person, initially during the first wave, you might have come across people, they have got a call. That means they are exposed to that particular person. But as the number of cases become high and based on the capacity issues for at the command center, we could not use it more effectively. Otherwise, it was a very good tool which was used for handling the contact tracing. But nevertheless, taking clue from this thing, many of the states, they have devised their own contact tracing mechanism and did the surveillance of the contacts and helped in containing the infection there. First time, you might have seen how the digital things have improved the pandemic management and the emergency management. Previously, we used to have the term of control rooms. This time, these control rooms, they have now been graduated into command and communication centers. That means they are commanding whatever information is coming and they are communicating back for some action. So information has flowed. You might have seen the ministry coordination between the different ministry has taken a leap forward in terms of use of the data between different sources. ICMR, you just giving an example, ICMR used to connect data on the laboratories and the other things. The IDSP program, which is under the ministry, it collects information on the patient and the contacts. The NDMA also have some information about the exposure of this patient. All the three data comes at one portal in the ministry, and now they are having good intelligence kind of thing for identifying the person where is the problem. Every day, if you look at the data which has been published on the website, every day they say that which are the districts which are having high testing positivity rate, which are the districts which are having more cases. That information is now readily available on the website. So that if information is available in the public domain, it alleviates fears, it reduces the fear. If you look at the way things have progressed during the COVID time, initially it was a fear response, then some confidence build up, people started coming and sharing that I am positive and everybody who has come in contact with me, they need to at least take protective measures. Now that fear is gone. Second important thing with the use of technology for managing this pandemic is how to provide the curative services. One is the preventive services, contact tracing, another thing that technology has come to the aid. And many of the versions of Aayog Setu kind of thing for contact tracing, management, containment measures are there. Different states have innovated and that innovation practices would be available in the coming days. The second important aspect was the care of the patient. We initially, when we thought that how to have, because it was a respiratory infection, we could not know that how many ventilators are there in the country. In the H1N1 epidemic, pandemic, which happened in 2010-11, there was a more or less a focus on the severity was there and people required ventilation during that time. At that time, we didn't have the information on ventilation. But this use of technology, the National Health Resource Repository is there. We try to build that how many ventilators are there from the installation base of the manufacturer as well as the sensors being done by the ministry. Having triangulated that, it gave us confidence in managing this, that we are having this number of ventilators. We need to prepare for the more number of this. These are the ways in which the pandemic, apart from that, you did how the digital technologies and other things in aided in faster response this time. In the having witnessed the earlier pandemic also, where we used to have meetings and for organizing meeting used to take a week's time. But this time you see every other day the ministry was interacting with the states, the higher officials of the state. The Honorable Prime Minister, he has interacted on more than 20 occasions with the different higher officials and the different chief ministers of the state. This could not be possible without the aid of the technology. Another thing which has happened with the use of technology is because during the first wave, it went off smoothly, but during the second wave, the virus outpaced us. As a result, for 2 weeks, the systems were overwhelmed, and you have seen the chaos which it has created. But fortunately, the technology and the practice, they have combined together. We thought that if we can monitor the oxygen saturation level at the home and monitor the temperature, identify if somebody can identify when the patient should be coming to the hospital, that will aid it. Now you have seen that maximum number of patients were managed at home because of the digital thermometer as well as the pulse oximeter, which aided it. To compound that, we have also used the technology in segregating and triaging the patient, that who are the patients who need hospitalization. The patient who are less than 90, if the saturation is less than 90%, then they can be managed at home. Only the patient who were less than 90%, they were sent to the hospital. More than 90%, they were managed at home with the help of oxygen concentrators. In this way, the things have evolved. The other important thing which has evolved during this COVID pandemic is the interesting use of the technology for expediting the informatics for vaccine and vaccine development and other things. During pandemic time, if you look at if somebody do a record repository for all these things, we will come across that how this informatics, health informatics, has revolutionized our understanding, so that the things which used to happen in many years now, that duration has come down. I was talking about the treatment part. In the treatment also, the information is being collated. Now during the third round, when you have seen, when there were fear that the Omicron would be impacting a lot of this, but we kept a watch on the hospitalization part. And that gives us confidence that with the level of preparedness which we are having, we could manage 2x, 3x number of the patients which we have witnessed during the previous peak. So that kind of use comes with the use of this technology. In the coming days, what can happen in the coming days? Now the digital footprints is increasing. I just cite an example when I was working in one of the backward states in the country, way back in 2002 to 2006, wherein people were very skeptical on use of the computers. From a program, we have provided computers right up to a block level. We thought that if the things are there, with the notion that the things are there, people will start using it. Still, that computers are there, they are being used increasingly for doing their administrative work, but that kind of literacy and things have happened. With the start of this health and wellness centers and with the opening up of the telemedicine guidelines, you see how the things will leapfrog in the coming days. In the health and wellness centers, all the sub-centers, the peripheral most outreach of the health system, they have been upgraded to health and wellness centers. And health and wellness center, one of the important component is use of telemedicine for managing the patients there, wherever they want to have a higher referral. That component is there, and slowly in the coming days, you will see that how that footprint of digital telemedicines would be available in more than 1.5 lakh health and wellness center. Second thing is with the ABHA thing, that is the Ayushman Bharat Health ID. You see that how people and everybody would be having an ID, and it will be a step towards having an electronic health record, which as envisioned would be used for monitoring the health events and the emergencies. The other aspect which needs to be mentioned here is when we started with the vaccination, when we started developing the vaccine, there was a question that how we will be managing this adult vaccination. Fortunately, in our country, for managing the immunization of the children, we had the e-vaccine means electronic vaccine intelligence network. The ministry was already using that. As the scope and the efforts were different, so that was adopted, and now you are having a COVID platform. This has been proved to a public good and ready to be used by many people. Right from the logistics management to beneficiary management, scheduling of the session, as well as the generation of certificates. All the things are inbuilt into technology. Otherwise, the next part of any emergency management is how to prevent the spread of that infection, and vaccination is part of that. And to assist this technology, assist this strategy, you see that how beautifully this COVID platform and the COVID software have been used. Had it been the scheduling of immunization session, in the previously, if you look at that, the way we have scheduling this, it used to take at least 3-4 days for scheduling one session, but it's matter of minutes now for scheduling an immunization session. Exactly, we know that how many beneficiaries are there. We can track the beneficiary, where the beneficiary has within 1 dose, 2 dose, 3 dose. Even we can track the fraudulent transactions here as well. But since it's a good cause, it is going for a good cause, that that aspect has not been activated, but it's there. You see that how collectively, you see, right from contact tracing, right from monitoring of the treatment, right from development of and use of the health informatics, and scheduling of the vaccination. This has happened. In the coming days, what is going to happen is the digital mission would be creating the IDs of all these people. Then the electronic health records would be more and more would be used. Apart from that, there is one platform which the ministry has created, that is integrated health information platform. And this would be, and all the other information of the other program, that is malaria, TB, MCH and other programs would be riding on this platform. And so that integration can happen. And there would be an increasing use of this for information generation as well as sharing. Because for a policies perspective, we require information so that that can be translated into some action. If actions are required, what are the bottlenecks and that can be identified. I will stop here. Thank you very much once again.
Thank you so very much, Dr. K. Madan Gopal. It's been a very, very enlightening session by you, and I'm sure that all our viewers had a lot to learn. Let me once again request our viewers to join us in the experience zone. We have a lot for you happening right there. So please do join us in the main lobby area. We have a word finder game which we've put together for you. It's going to be exciting to see you play that. I'd also like to encourage all of you to please take to your social media. Do share with the world what we're discussing right here on our Theme Futures Now, bringing health innovations to the forefront. Up next is going to be a very interesting session on changing fertility care for generations to come. So please do stay tuned.